Hello. Hey, this is our OB floor walkthrough. Once again, I'm Dr. Bird. This is Annette. Hi, Annette.
Hello.
And this is Vanessa.
Hi.
And we're going to take a walk through the OB floor and just kind of show you some things that might be interesting, I think, if you ever come up here and need to come up here about what's going on the floor. So with no further ado, the first place I'm going to take you is to a place that has changed quite a bit from when I started my career. We're going to go into the nursery. So here's the nursery. And I think you might notice something about the nursery that instead of what you would see in movies or those type of things. What's not here right now?
Babies.
Oh yeah, there aren't any babies in the nursery. What's up with that, Annette?
We like to keep them out there with moms and dads now.
Okay, all right. So I've heard this term baby friendly. Is that part of that whole initiative to have them out there?
It sure is.
Okay, all right. So Vanessa, when would a baby be in this room?
So we would bring a baby into the nursery if they needed a little extra TLC. So if they needed a little respiratory support,
Okay.
they were born a little prematurely, then we would bring them in here to do further interventions and provide that support to them.
Okay, got it. So it's really select situations now. It's not like in the old days where this window they open up and you can look at all the babies and all that kind of stuff.
No, we leave the babies with their moms and dads.
Okay, all right. They get that being together right from the get-go, right?
Yep. That's
Okay.
right.
Vanessa, what is that little contraption there supposed to do?
So this machine is called a neopuff, and it's really kind of cool. In the movies, a lot of times you still see the traditional mask with the bulb that you squeeze. Well, this machine offers respiratory support by using, caught up there, this little mask. And instead of squeezing a ball, you simply just put your finger over this hole here. And each time I would do this, it would offer a breath of air for the baby.
Oh, that is slick.
Yeah.
Oh,
Very
wow.
nice.
That is nice. Okay. All right. Baby breath. All right. Good. I think, so this was a pretty quick tour of the nursery because there's not babies to see, which we wouldn't do for HIPAA purposes either, but nonetheless, this is our nursery.
And we now store our cribs in the nursery
Okay.
because of COVID, and
Yeah.
we only have 3 cribs left, so that tells you something.
Oh
about
yeah,
how it's
the
going
floor is
today.
kind of busy today. So, all right. Let's walk in another spot that I think some folks would be interested in seeing. Hey Annette, where do you think we should go to next?
I think maybe we should try out the whirlpool room.
Ooh, whirlpools.
Yes.
Yeah.
Give our
Yeah.
patients some comfort and take the pains away for a while.
Okay. I think that sounds like a good plan. Off to the whirlpool we go. All right, Annette, tell me what's going on here. What do we do for the women who have delivered babies?
Well, in here we offer them the whirlpool to relax and relieve their pain if they would like to come in here for a couple of spurts of, just to get away and relax. It helps relieve that back pain, the discomfort of those contractions sometimes in the up in the abdomen, and it just relieves that
Yeah.
discomfort.
This looks a little different than your typical whirlpool in that, the big jets you don't see. You have more of these little bit. I don't know if Liz's camera's picking that up, but there's these little bitty perforations. What's going on with that, Annette?
That just gives them the bubble effect, and doesn't really do anything for discomfort or anything, or bubbles.
It's for bubbly. Okay. All right.
Sometimes visit the whirlpool room after delivery too, if they have had a tear
Yeah.
and want a little bit of warmth after 24 hours. They'll come in here and just kind of relax for 10, 15 minutes
Yeah.
to kind of take away some of that discomfort as well.
Sure. So I guess I was understanding that I thought it was for after delivery. This is also if you're in the process of you're in labor, it gives you a little bit of I did not know that.
But we do not do
Before
water.
I was gonna say you don't do the you don't do the Madonna thing. And,
No,
okay.
no.
All right, just checking. A lot of stir may have come up out of all this. So all right, so no, we don't do deliveries. Okay, we don't, but you can't control deliveries all the time.
We are prepared.
Have we ever done a delivery in the tub?
Knock on wood,
Okay.
not yet, but we are prepared. We have all our instruments ready in
Emergency
case
kit
we
and
do.
everything ready to
Okay,
go.
all right. So
Yeah.
all right.
Yeah.
Very good. Okay, let's go somewhere else. How about a room
Okay.
where we would have labor and delivery? And I think you're gonna. What's the deal with this room that you're taking us to, Vanessa?
So we have a designated room for our COVID positive patients, or those that we're expecting to maybe come up as positive once we have the results back. So this room here is where we would put those moms for their delivery, and that's where they would stay throughout the duration of their stay.
Okay, well, let's take a look. Come on in. Go ahead, Vanessa. Go ahead, Annette. Annette, I forgot to ask you, Annette. You have some title that you do here too. I didn't even. I failed to ask you. What is your role?
Well, right now I just changed over to the OB educator, quality improvement coordinator.
Okay.
But I also was doing the follow-up visits. So when
Yeah.
moms and babies come back,
Yeah.
we check them over, make sure everything's going great for
Yeah,
them, and help them with any needs that they need.
Sure. Do you still do that, or is someone else doing that now?
Well, Marcella is going to be taking over with
Okay,
that,
okay.
and a couple of the other gals, Amy and
So you're
Heather.
transitioning out of that role
Yeah.
and doing more of the education
Yes,
stuff.
which
Okay.
I'm going to miss that a
I
little
bet you
bit.
will. Yeah. I would get calls from you every once in a while about, hey, here's
Yeah.
taking a look at a baby, and what do you think about this or that? So
Exactly.
Yeah.
So,
So, ladies, tell our folks that are watching some things that is typical about this room, and the things that are a little different because of how you have it set up for COVID.
Okay.
You want to take that on, Annette?
well, we have everything set up in here so that we can hopefully keep everybody together in this room at all times. Specifically, when baby is born, we'll take the baby over and check the baby out, and as long as everything's fine, we keep them all together in here, as well as dad or whoever's with mom.
Yeah. So in terms of like the bed itself, it's a labor bed. So my hunch is that this bed can be like a bed, but then it can break down when it's time to go ahead and have your delivery.
Definitely. Yep.
Okay. All right. So this bed, we won't do it, but it breaks down to be able to accommodate that. Now, obviously, we don't do C-sections in these rooms. So if someone is not progressing and/or something's going wrong with the baby, or you have some concerns, then they would go down the hallway for their C-sections.
Correct.
Okay.
And then we just prepare all of ourselves with the correct PPE.
Yeah. Okay.
We've actually drilled that scenario too. If you have a COVID positive
Ah.
patient who needs to go to the OR,
Yeah.
how do we navigate that to
Sure.
get them back there safely while not contaminating the unit?
Yeah.
So we've been through drills to help prepare us for that because
Yeah.
it did happen in real life. so.
Okay. All right. That's why we drill. This looks a little more than I would normally see in a labor and delivery room. So tell us a little bit about that, Vanessa.
Yeah, so this is an isolette. We don't typically have these in labor and delivery rooms, but this just offers a physical barrier for the baby. So if the mom is actively coughing and symptomatic, then the AAP, the American Academy of Pediatrics, they request that the baby is put into an isolette so that you have that physical barrier to kind of help protect the baby from spreading that infection.
Okay. So like if a mom is COVID positive, then the baby's in the room still, but they're in this isolette.
Correct.
How about if the mom is breastfeeding? What do we do then in that?
We encourage them to keep their hands clean.
Okay.
We have sanitizer close to them as well. We encourage them to mask.
Okay. So they're still breastfeeding though, even if they're COVID positive.
Yes.
Okay. All right. Yeah, and you guys have these folks for a C-section at maybe nowadays 2 or 3 days, but so it'd be hard to tell if babies are getting COVID from moms. Do we have any sense of that?
We do testing on the babies as well at 24 hours and 48 hours is
Yeah.
what they recommend.
Yeah, but that wouldn't necessarily pick anything up because most infections take a little while to
correct.
Yeah. Okay. I'm
I
just
feel
curious.
Like most of the
Yeah.
transmission is horizontal.
Okay.
later
I
on.
haven't read a whole lot about babies getting COVID from moms, but I be honest with you, I haven't done a lot of research on that. So, okay. Anything else about this room that I saw when Annette opened up that door there? What's all that for, Annette?
Well, we have certain restrictions that, with any of the COVID patients, that we don't want to run any oxygen for anything that's going on, just in case
Okay.
of transfer.
Okay. All right.
So we just want to be very careful.
So how do we do it differently then with a COVID situation?
If we
they
needed,
needed oxygen.
if we needed to, we would go over here and be farther away.
Okay.
from,
Okay. All right. Got it.
um,
And then this is if you didn't have this sign up though. This would be what you'd have for
A regular delivery?
Yeah. So
Yes,
if mom
for
needed
mom.
some oxygen or-
And suction.
Okay, all right.
All
So,
that
yeah,
good
when
stuff.
you're going through the process of everything, so.
Yeah.
Okay. All right, well, good. Anything else that I would want to add about this room here,
No,
Vanessa?
otherwise it's a typical.
There's
delivery
bathroom
room. It
through
looks
there.
Just, yeah,
Yeah.
looks just like any other delivery room except for extra piece of equipment, and then we go ahead and leave these devices in here throughout their stay. And once
Okay.
the mom goes home, then it's all cleaned together.
Sure.
In a special way.
Okay, good. Hey, I think you were telling me, speaking to what you are transitioning out of, Annette, that room where moms or whoever goes with the baby after they've been delivered, they've been discharged, and they come back. Can we walk down the hallway and take a look at that? Okay. all right,
Definitely.
All right. Since this is kind of your kingdom that you had for a number of years, I know you'll be able to give us a good tour, so. How many rooms do we have here?
We have 10 rooms.
Okay, all right. Sounds like we have a decent number of them being used right now.
We do.
That's good. That's good.
Typically, when moms and babies come back, we have them come back in here. We have them just sit down, relax, take it easy.
What's the
and
time frame that mom and dad usually come back with the baby?
It's usually 1 to 2 days after they've gone home.
Okay.
And then we just make sure mom's doing okay with either breast or bottle feeding.
Okay.
And then we check over for jaundice, make sure that level's okay. If we need to do any interventions there, we'll do that. Make sure mom's blood pressure's okay.
Okay.
And just
So
answer.
it's mom and baby when they
Definitely.
come back. Okay.
Yeah, even dad, he's
Yeah.
in the picture too, so.
Really? Okay,
We don't,
yeah,
we
yeah.
don't want
I
to
wouldn't
take
neglect
away
it.
from them too,
Sure.
so. Or,
'Cause I always
any
heard from you more
significant
on
other.
I always heard from you more on the baby side because I'm not an
Yeah.
obstetrician. But okay, so the moms get a check over, baby gets a check over.
And any concerns that they have, any questions that they
Yeah.
have, we try to answer those or point them in the right direction.
Yeah, it's a great service because I there's even if it's not your first child, every
There's
child
lots
can be
of
a little
questions.
different.
Yeah.
How
They're
long does
all different.
how long does your typical visit take if you're doing something like
Usually
this?
about half an hour, I would say.
Okay.
Yeah.
all right, Okay. Yeah, that's a solid amount of time. So.
Yeah.
Good.
They come in here crying sometimes and they leave here smiling, and that's what makes it all worth it.
Oh, that is awesome. Yeah.
Yes.
Okay. Thanks everybody for tuning in. Take care. Bye.